At this time, I would like to turn today's program over to Canada Health Infoway. The floor is yours.
Hello, everyone, and welcome to today's webinar on Health Information Networks, Leading Practices, and the Maturity Model. My name is Ron Parker. I work for Canada Health Infoway, and I'm happy to introduce Dennis Giokas. He's our Chief Technology Officer, and he'll be taking you through the material today. So just a couple of things as we begin. Just to be aware, this will be recorded and it may be posted on our website and used for future internal or external education sessions. We're only taking questions by the web, so use the Q&A feature, which is in the right-hand panel of the WebEx screen. If you want to ask a question, we'll pose the question on your behalf, and we won't use your name. We'll just post the questions as they come up. Be aware that the PDF of this presentation will be posted both in English and French about a week after today. So everyone's been muted. As I mentioned, please use the Q&A function. And just to emphasize, this represents solely the views of Infoway. It's informative. It's not meant to be suggesting any particular direction of Infoway corporately in terms of funding or any other strategies. And we're not attempting to implicitly or explicitly endorse any particular technology solution or any vendor. We really don't speak too much to that in the course of this. Next. And then just before we begin, to give you a little context, this was a project that was begun last year in 2015. Dennis led this project. We partnered with Gartner, actually, to have them do a lot of the research as part of this work. They polled internationally around this subject area. We looked at a lot of things happening in different countries, and particularly what was happening in the U.S. And out of that exercise came a better understanding of at least what we would consider to be leading practices in this field. And in addition, what we did is the team adapted the nature of the content and the perspectives that we saw to the Canadian context, and went one step further, which was not only to describe the nature of health information networks and the aspects of them, but also to take a crack at understanding what constitutes maturity on the part of a health information network, and to be able to describe that. And that's actually been really, really informative and very interesting. This content has already been published, by the way, on Canada Health Infoway's general website at infoway.ca or offroute.ca. You can find the content there under Resources, under Emerging Technologies group. And you can download both the main document, the HIN paper itself, as well as the proposed maturity model. So with that intro now, I'd like to introduce Dennis Giokas, who will take you through the rest of the presentation.
Great. Thank you, Ron. Good afternoon, everyone. Just a brief agenda to set some context for you as to what we will cover today. A couple of years ago, Infoway did an interoperability strategy, so I'll put this particular project in that context so people have an understanding of how it fits into that overall strategy. And then with respect to this particular project, look at the objectives and deliverables. We've got a formal definition of what we call a health information network. And then we'll go into the two key outputs of the project. One is just an overview of the leading practices. They're well documented in the white paper that Ron spoke to. But I just want to give you a sense as to how they could be used, kind of bring that to life a little bit. And then another piece of work, which is what we're calling the HIN Capability Maturity Model, which is a discussion paper that we've published to begin to have the conversation literally with jurisdictions and vendors and others on what makes for a mature health information network and how we're going to be using that and refreshing it and revising it on a go-forward basis, which leads us to the last agenda item around next steps. So without further ado, let's just jump right into the first topic, which is the interoperability strategy and the context with respect to this particular work. The path forward of that strategy had 5 key elements to it as part of its path forward. One is unleash the clinical leadership. realign our efforts to focus on interoperability specifications rather than just standards, focus more on the specifications that bring those standards to life in a real-world use case kind of context. Thirdly, use simple, open technical solutions to enable interoperability, modernizing our tooling as well as the standards we use in that context. I'll go to the last one, the fifth one there, allow all stakeholders to have a voice in clinical interoperability, and one thing we wanted to do is certainly leverage the clinicians and the clinician voice in that context. And this project is about the fourth one. One of the things we observed was these health information networks, or health information exchanges, as some people refer to them, were not viewed as a true operational entity, and we wanted to migrate these to a new way of thinking about how they are not only deployed but operated for the benefit of point-of-service systems that need to connect and share and exchange data, but even new solutions that have already emerged, such as smartphones and tablets and the apps against those that might need that same data and participate in even more complex advanced clinical uses, such as e-referral or order entry and fulfillment and things of that nature. The strategy also had 5 perspectives. One is just the stakeholders themselves that are all engaged in interoperability and with respect to health information networks. There's a clinical perspective back to the clinicians and their needs and wants, specifications around the things we produce to achieve interoperability, the product perspective such as health information systems in hospitals, EMRs, and community physician offices that have to connect and be a participant in that health information network. And this particular work falls into the last one, which is the operations perspective, standing these things up as kind of always-on operations that support all of the other business functions in the context of healthcare delivery and administration. So what does success look like? As part of the strategy, these 3 elements were highlighted as success criteria. Number 1, that health information networks use these common interoperability specifications. We all know that there's benefit to Canada if things are consistently designed and deployed across the country. Makes it a lot easier for us from a cost perspective in standing these things up, but much, much easier for the vendors if they see things in a consistent fashion from province to province and territory to territory. Secondly, these clinical health information networks are operated as a service. Why is that? Well, we've seen examples of some being really run as projects, and the fact that I might want to connect to one of these networks is in itself a project. And that creates a bit of a barrier or a burden for vendors and others that are trying to make this data available to authorized users, and certainly the systems that those authorized users want to use on a daily basis. And then thirdly, rapidly enable this clinical data sharing with the right information at the right time. There's a lot of data that's being captured in these various domain repositories as part of the interoperable EHR, and it's just taking much too long to connect and make that information usable to the right end users. So let's move into this particular project, its context, objectives, and deliverables. From an objective perspective, we had 3 key inputs. One was that graphic I showed you earlier, the various multi-stakeholder perspectives, including those of clinicians, vendors, and operators of these kinds of systems, and last but not least, those that are writing the specifications and promoting those and providing education and training on them. If you recall, about 5-6 years ago, Infoway did a strategic paper called the Opportunities for Action, those various new uses of digital health solutions like new models of care, bringing care closer to home, enabling a high-performing healthcare system are examples of themes in the opportunities for action. We use that to understand how these health information networks might be used in the future for advanced functions like I mentioned earlier, like e-referral or order entry and fulfillment or even analytics. And then last but not least, the strategy itself, which I put that in context already and showed you what we believe to be some of the success factors. So as Ron mentioned, we engaged Gartner Consulting to work with us on this particular project, and they went out and looked at leading practices literally in Canada, the U.S., and internationally. We had 3 strategic drivers that were out of the clinical interoperability program itself that helped frame their interviews with those other HINs around the world. How could we increase data access and enable the advanced clinical uses in the context of systems connecting to each other and having to interoperate in that context? How could we transition HINs to a service model to maximize their utility and ultimately the benefits they can and should be providing to both clinicians and consumers? And then how could we accelerate our whole integration or interoperability program and reduce the effort for compliance? So we wanted to provide insights really across what I call the software development life cycle, from planning to design of these HINs to ultimately how they're deployed. But one area that we've tended to neglect, certainly Infoway's been guilty of that, the operation of these. We've never invested in operations based on our funding agreements. We've put little emphasis on it as an organization. So with this, we wanted to really shine a bright light on the operational aspects of these HINs and put a lot of emphasis on that particular, because that's where we're all going to spend the most time. If we're in planning, design, and deployment for 1, 2, maybe 3 years, operations is hopefully 10, 12, 15 years or more. And we wanted to put a lot of emphasis on that particular aspect of these solutions. So out of this work, we got 4 key deliverables. This is just a graphic to show how they're interconnected, and I'm going to drill down into each of these in the subsequent slides. So I won't speak to them in any detail at this point in time, but as you can see, they do interrelate and build upon each other as you go from the upper left to the right side of this particular screen. So what is a health information network? Probably a lot of you have heard this term, health information exchange. Even in Canada, we've heard the term used. Yeah, we have a HIL, which means, I've got EHR domain systems and registries and some kind of enterprise service bus, otherwise known as the HIL, the Health Information Access Layer, and point of service systems connected. So we've used those terms quite a bit in a Canadian context, and part of what we as a team and with our advisory board is to literally coin a new term, health information network, because we wanted to convey the fact that there is a set of broader capabilities beyond just the exchange or even the sharing of information. And it's really a key enabler for what we term an IT-enabled health ecosystem. The graphic in the middle, even its layout is important, so I'm going to actually start at the bottom. One of the core capabilities is information exchange and interoperability. And when I use the term exchange, I'm using it broadly. It does also include information sharing. In other words, the information is in a domain repository. It's there to be accessed and used by anyone or any system, certainly if they're authorized. And that particular core capability is used to obviously make key clinical information available literally across the continuum of care in the right context to the right person. But that same clinical information is used for the 2 core services listed above. One is just business and clinical process management. How do I coordinate and manage a transaction, especially a long-running transaction? And many of those are data-driven. Some may actually be event-driven. So if I'm doing e-referral, and one of my favorite examples to use, I might be referring to a particular person. I might be referring to an organization, such as a specific hospital, or I might be referring to an agency that might have a specific function like cancer care. So that might be a data-driven referral based on the type of referral it is, or based on wait times, or based on events. How critical is this particular referral? How critically important is this person need to be seen in a short time versus a longer period of time? So this is that aspect of what many people call business process orchestration, as well as the analytics against that business process and knowing where things are in the life cycle of that transaction. The one to the right, we termed health information services. Probably one of the best examples of that in the Canadian context is our drug information system program here at Infoway, where we've funded the deployment of these drug information systems, but also have funded in that context drug utilization review. So think of that as an information service that stood up as software as a service. It's stood up within the HIN context, but there could be many others in the future in the same category of clinical decision support. There could be others in supporting order entry and fulfillment. There could be others that support even analytics, which we're viewing as a health information service as well. So we're looking forward, understanding what an HIN could do to support the functions of a healthcare system in the future that are aligned with anything we can conceive, especially those core capabilities that are in the Infoway Opportunities for Action document. If you notice the title, I rarely do this, underline a few key words. And this is hard for me to get my head around, I'll be honest about that, that an HIN is not a technology thing. It's really an operating organization with some enabling technology. And it's really important for us to get our heads around that concept, that it's either an organization or maybe a group of organizations that have some kind of federated relationship with them, but probably more important, a governance structure that brings them together, so they're viewing this HIN really as an operating organizational entity, not a technical entity. And it's a really important concept in order to kind of shift from a technology-focused function to a service function. So think about that. It took me a while to get my head wrapped around this concept, but once I fully understood kind of the meaning behind the words, it became a very powerful enabler for me to bring this forward. So what are some of the distinguishing attributes of a HIN? And in the context of this work, we identified 3 key ones. One is it enables the extensive reach across the continuum of care. I gave you some use cases earlier. But looking at it from a different dimension, these might be and are typically across non-affiliated healthcare delivery organizations. We tend to see GPs in one organization, hospitals, many of them across our various provinces in different organizations. There might be community care, there might be public health. There are many organizations involved with the continuum of care that need to be connected through a health information network. And that leads to the next item there, which is the geographic disparity of these organizations. Even here along University Ave in Toronto, where our office is located, there's 5 hospitals just up the street from us. The geographic disparity between them could literally be across the street in their ability to share information effectively, but it could also be across the province or maybe in the future even across the country. The second thing we see is these solutions and the HIN itself can enable the improvement of clinical value and outcomes. It gives clinicians access to the right information in the right context, and it can facilitate and coordinate those clinical information processes, which I highlighted earlier around clinical process management based on data and events. And then last but not least, the best ones are sustainable operating entities. There is some kind of organization or federation of organizations behind it. Probably the most important aspect of that is that there is governance and a governance structure and a terms of reference associated with that, so it's very clear what they're empowered to do and how they will function. They're sustainable from a financial perspective. So those organizations that are connecting have some confidence that this thing will be long-lasting and viable in that context and kept current through that financial sustainability as well, which leads to the last item here, the ability to adapt to support new functionality, in other words, new clinical requirements, and stay current technically to support new requirements as well. So let's jump right into the leading practices. As I said, Gartner Consulting did a lot of primary research interviewing various organizations. They also leveraged their research in healthcare as well as other industries to bring forward some leading practices in that context. And just to put this in the right context as well, you got to view these as leading practices at a point in time and limited by whom they talk to. So there may not be some here that maybe we should have discovered if we had talked to another organization, or there may be some new ones discovered if we were to redo this project today versus roughly 18 months ago. So it is what it is. One of the things that Gartner did is produce what they call the discovery framework. It has 8 categories. This in and of itself could be very useful to those on the call today. Think of it as a checklist under each of these 8 categories that you could utilize, maybe even enhance for your own uses around understanding, are you thinking of everything in the context of your health information network. The layout of this, like the HIN definition graphic, is somewhat deliberate. You'll see the 4 columns along the top. Notionally, those align with the software development life cycle. Kind of a beginning of a project. Do I have one? Is there a strategy? Are there incentives to even undertake some kind of project? Then I might go into a planning and scoping phase, looking at my requirements, looking at who the end users are, what are the clinical use cases, and things of that nature. Then I go into implementation, where I actually stand the solution up, including all of the supporting elements of that around certification and testing and privacy and security. And then finally get into that operational state where I manage it as a sustainable entity. The 4 categories along the bottom, governance, benefits realization, skills, and resources, as well as stakeholder engagement, think of them as swim lanes. So they really cut across those 4 columns at the top, but the nature of them might change based on the life cycle phase one is in. So I'll just pick one to give you an example, benefits realization. The first instance of that might be, do I have a business case? During the planning and scoping phase, I might develop my framework for benefits evaluation. During the implementation phase, I might put in hooks so I could actually capture some information as the system is running for outcomes or other metrics that I might want to measure based on my benefits framework. And then in the operational phase, I actually execute on that framework, gathering and analyzing the KPIs to determine whether I really do or did get the benefit that I thought I would get, and maybe make adjustments in certain areas if I'm not. So as I said, those 4 swim lanes at the bottom, the nature of the activities in each of those categories does morph a little bit as I move through the software development lifecycle. What we did discover, though, we found 11 leading practices. They were only evident in half of the framework components, in other words, 4 of the 8. They were evident in governance, stakeholder engagement, implementation, and operations. But in the context of trying to make these HINs more successful from an operational perspective, certainly are 4 very important categories. So what are the characteristics of these leading practices and the way they're documented? We want them to be relevant to us here in Canada, actionable and demonstrable. We'll come back to that a little bit more when we talk to the capability maturity model. As I said earlier, it is based on evidence, primarily through primary research, but supported and corroborated by Gartner research and other publications that we leveraged that were on this particular topic. And each of the leading practices has really, in its full instantiation in the white paper, 3 parts. The active statement describing it and how it could be applied. What you'll see on the next slide is just a brief statement as to what it is, but so the white paper goes into a lot more detail about its application. And then it covers 2 other areas: opportunities that might be afforded by applying that leading practice, as well as challenges one might experience when applying that leading practice. So those 2 lists, if you will, give the reader and user of these leading practices some additional insight as to how one could either benefit from it or be challenged in trying to apply it. So very quickly, I'm not going to go through these on this slide. These are the 11 leading practices, but what I'd like to do is bring about 5 of them to life. And it's not only each leading practice that can be used on its own, but as I bring it to life, one of the things I want to convey is how these do interrelate to one another and should be thought of in certain instances collectively, not as just individual leading practices. So let's get started. The first one I want to speak to is leading practice number 1, engage entrepreneurial executive leadership to drive implementation and operations. This was seen in pretty much every health information network success story, at least of those that were interviewed. You really need that, like every project, that executive leadership to set the tone and to drive the project through their executive leadership. But the other key word here is entrepreneurial. Think in a different way. Think entrepreneurial. Think, in some cases, out of the box, but also adjust quickly, pivot quickly, accept failure in that context as well, and adjust to the learnings from that failure. So it's a different mindset. And in part what I'm saying is, you know, you can't take a rigid waterfall approach to how you implement and operate these things. You got to react quickly to maybe new needs, maybe new requirements that might surface. So that leads to the next one I want to cover is focus stakeholders on practical and meaningful outcomes. So, you know, think of it from a clinician perspective. What do you want to achieve? What outcomes are necessary for you to be successful in delivering health care? And are they practical and meaningful? And then start thinking about the requirements to achieve those particular outcomes. So it's kind of turning things upside down a little bit as to how we approach it rather than just starting from a blank sheet with requirements gathering. Which then leads to the next one. Those that were most successful took a clinical scenario or use case-based approach. And in one instance, one of the HINs we spoke to took that even further. They were accountable to its success. They were accountable to the outcomes against that use case. They were accountable to the benefits evaluation in that as well. In some sense, they were the executive sponsor of that use case, which leads back to the first leading practice. So it's very important to look at the outcomes and then take a use case-based approach in how you might achieve those particular outcomes. And a number of use cases might contribute to your desired outcomes as well. As we all know, data are important, critically important to all of these use cases, but one of the biggest challenges we all face is who owns the data and the associated data sharing agreements, and obviously related to that, privacy, security, and consent associated with that. It's often a barrier. We've got to define it more clearly, collectively across the country, regulate it and or mandate it, or even incentivize the use of that data more effectively in order to get the most benefit from these health information networks. And then the last one I want to cover is the adaptability, kind of leading back to that entrepreneurial word in the first leading practice. We've got to be adaptable, and that includes the approaches to technical architectures and even technical solutions that are stood up, and be responsive to, the use cases and needs of the stakeholders and support those data sharing use cases effectively. So as I said, take a look at the white paper. A lot more depth behind each of these 11 items, including opportunities for use and challenges in their use, and a lot more insight, including references to those HINs around the world where we saw these in real-world practice that you could actually reference as well. We did, interestingly enough, not find some things in the evidence that we thought we might find, or some things that we do here at Infoway that leads to the first one is benefits realization. We didn't find any health information networks or exchanges across the world actually managing, measuring, and reporting on benefits realization. Some of you may know here at Infoway, virtually every project we do does have a benefits evaluation component to it, and we certainly believe it's the best practice, but we didn't see that in the context of the HINs themselves. We didn't see any HINs using healthcare analytics. During the course of the project, we did see a headline that the state of Maine was planning to do it, adding some analytics capability to their health information exchange in the state of Maine. And interestingly enough, I saw a press clipping maybe 4 to 6 weeks ago, again from the state of Maine, saying they did it. So that was great. They did what they sought out to do, and it's not that all analytics are done in an HIN, but there are opportunities to use that data that might be there, that might be flowing through the HIN, could be even streaming analytics in real time against what's going on. Let's say it's admission, discharge, transfer kind of analytics within a healthcare delivery organization, or even more broadly a healthcare region. Everyone spoke to governance, but we didn't see any consistent set of principles or structures. Gartner asked some of these HINs if they could share that. No one was willing to do that. We all know we love governance. We all know we should have it, but no one would claim to have the best framework for it that we could share. Trust relationships. Again, no consistent set of principles or practices to manage trust, both from a human perspective as well as from a system perspective. And then the last one was quite interesting, with all of the focus around the world, including Canada, around patient engagement and consumer health solutions. None of these HINs were being used in that context at the time we did the interviews. So that was very interesting to hear as well. So as part of the initiative, one of the things we wanted to do was take all of the learnings from the research, including the leading practices, and develop a capability maturity model. Think of it along the lines of a blend between the Carnegie Mellon software engineering capability maturity model and the HINs EMR maturity adoption model. Obviously, it's going to be healthcare related, and we put it in the context of health information networks. So we wanted to provide a reference model that could be used literally across the country, looking quite broadly at a number of areas, which we'll go into in a second. We also wanted to develop it and tailor it for current requirements, but also future requirements or a vision for what HINs could be in the future. And we wanted to use this tool to drive action and change. So it provides really three functions. One is it can be used by stakeholders to do a current state self-assessment. Look at your current HIN and where are you on that maturity scale that we've published. Given that, I could use it as a planning tool. I could say, well, this is what my HIN needs to do in the future, therefore, given these clinical requirements and use cases and outcomes, et cetera, this must be my future state maturity. And then last but not least, I could use that as a roadmap. So I take my current state, take my future state, understand the gap, and what's my roadmap to fill that gap. So it might be a multi-phase, multi-year project to close that gap, hence on a roadmap to advance my maturity from the current state to a future state. This particular artifact had a number of things that fed into it as well. That graphic on the far left is a graphic out of the Infoway Strategic Opportunities for Action Plan, which is on our website. The other two you've seen already, the core capabilities in the HIN definition, as well as the discovery framework, and that led to the image on the far right, which is representative of the two maturity models we produced. One's what I refer to as single dimension, the chevrons there on the left, and then the multicolored one on the right, which I refer to as the two-dimensional maturity model, which has 10 different domains of maturity, and each model has 5 levels. So we have reviewed this with the Gartner team, the Infoway team, and an advisory committee. We have published the maturity model. We've published it as a discussion paper, and I'll cover the reasons why in a couple of minutes. So what are its attributes? A set of structured levels to describe behaviors, practices, processes, capabilities, and milestones. It even mentions use cases. It even mentions what kinds of systems are capable of being connected at each of the levels. Each of the artifacts has 5 maturity levels. We wanted to keep it pretty simple. There's one very simple view, like the MRAM model, kind of single-dimensional view of key attributes at each of the levels. And then there's another one that covers 10 domains and more in-depth capabilities in each of those domains. So you as an organization could assess yourself on each of those. So you might be at level 1 in skills, and level 2 in financing, and level 3 in an area of benefits realization, for example. And then what are some of the characteristics and goals that can be accomplished in your HIN at each of the maturity levels, such as use cases supported or kinds of systems and processes that could be connected to one another. So here's a view of this kind of single dimension of view. I'm going to drill down into level 3 in a couple of slides, give you a little bit more in-depth view of that. Here's a list of the 10 domains that make up that two-dimensional view of the maturity model. Many of these are right out of the discovery framework, and some are net new in that context. If you recall, the discovery framework had 8 categories. Obviously, this has 10, but very, very much in alignment with that framework as well. So each of these 10 domains has 5 levels of maturity, and so you as a team could assess yourself against each of these 10 categories, and then kind of harmonize the scoring to come up with an overall maturity level as a numerical value. Just to give you a sense as to what it's like, this is level 3 Interoperate. This is where I personally feel most jurisdictions, if they're not there yet, should strive for over the next 2 to 3 years. The first being the HIN organization needs to be firmly in place. That is either an organization or a set of organizations under a common governance framework that should be firmly in place to operate and enhance your health information network capabilities. Enhance meaning new revisions to it, new capabilities. The HIN manages the data sharing agreements. It's very clearly defined what the roles are, what the valid uses are, partly managed by privacy legislation, but partly managed by other policies and regulations as well. HIN at this level is starting to see the enhancement of healthcare delivery across the continuum of care, what we would term here at Infoway care coordination and care management and collaboration. So it's not just a matter of just pulling down data, it's a matter of multiple players in multiple organizations using that data in a coordinated and collaborative way as well. To that point, the data is flowing to the right clinician at the right time, obviously for the right patient in support of care, such as chronic disease management being a good one. Privacy and security, and especially consent, and the rules around that are firmly in place and are agreed to by all stakeholders and are managed through the HIN as well. The HIN is engaged in health policy development. If you've got that entrepreneurial executive leadership, they should be involved with that as well, and then supporting the needs of the future health policy directions as well, so that the HIN is an enabler for that, not a disabler for that. And then finally, there is some relationship to what we call benefits evaluation, establishing the metrics for quality, cost, access, and outcome of healthcare services. So it's contributing to the overall KPIs of delivery of technology. So let me just summarize a bit and cover one of the key next steps around the maturity model that hopefully this audience would be interested in. When we set out to do the interoperability strategy, we had really 3 strategic drivers and clinical priorities. And this matrix here down the left-hand side there lists the 3 strategic drivers, and the columns are the leading practices. And good news is it's pretty densely populated. Many leading practices support each of these 3 strategic drivers, the first being increased data access and advanced uses. The second being transition to that service model, and then the third one being accelerate systems integration and vendor compliance. So, leveraging those, leading practices, putting them into practice kind of in an interactive, interplay way that I showed you earlier would be key to helping support your strategic drivers as well. We also were able to summarize this into 5 key actions for success. Align interests across all stakeholders and organizations. Strengthen and operationalize governance and stakeholder engagement. The key word there is the operational phase of the HIN, where most of us are going to be spending our time. Focus your interoperability on use cases and the outcomes you want to achieve with those use cases. Operate the HIN as a business services model. It's not a project. It should be there as kind of a dial tone, if you will, for systems and users to connect. And then widely publish the benefits achieved, process, outcome, and other benefits metrics. As far as next steps around the maturity model, as I mentioned earlier, it is posted on our website as a discussion paper. We want to and have already actually applied this in collaboration with stakeholders. A few provinces have had workshops with us. One in particular has had multiple workshops to do, in the first workshop, their current state assessment, in the second workshop, a little of future visioning, and then either with us or without us can do that gap analysis and action plan. So we want to see stakeholders across the country utilize this material, and we will be willing to help if asked. More importantly, we want everyone to help us revise this. So as we apply it, we will learn and refine the bullet points in each of the domains, or refine the wording, or add some or delete some, maybe move some around. So as we put it into practice, we anticipate some revisions will be necessary. And so we will make those, and we will make those available to stakeholders. Between Ron and myself and a few others at Infoway, we will post those on InfoCentral and kind of keep a community active on InfoCentral, and a community group has already been set up on this particular topic. And then last but not least, we know the uses of HINs clinically, technology, all are changing at a very, very fast pace. So as the needs and uses evolve, we will evolve the maturity model if necessary to stay in alignment with those particular trends. So thank you very much for joining us today. As a reminder, please use the Q&A feature to ask questions. And we've got about 13, 14 minutes. We'll take questions until the top of the hour.
Great. Thanks very much, Dennis. So people, you were able to submit in the Q&A section any questions. We do have one already. Do you know of anyone publishing the domain concept for the MRAM maturity model?
That's a good question. I don't know offhand at a domain level.
Right.
I have seen some work HINs has done around analytics maturity model, and if I'm recalling the presentation correctly, it did drill it down into domains, but don't quote me on that one. But
yeah, it seemed to me that this was quite a particular consideration. And where will we get a copy of the slide deck?
Yeah, so this will be posted on our website. If you look at the resources page on our website, it'll be there, and under the webinar section as well. And if you've registered for this webinar, you'll get an email once it's posted.
Any other questions? So Dennis, you mentioned that some are already doing this. How would people go about getting some assistance in terms of taking a look at this model and applying it themselves?
Yeah, I think the first step would be to read the two papers. I would look for some executive sponsorship, back to the first leading practice around this, but look for some executive sponsorship around applying the maturity model, and get those executives to read the executive summary of both papers, so they have a sense as to what you're about to embark on. The particular province that we're working with now does have that. The CIO for healthcare in that particular province is the executive sponsor, and they're quite involved with the process and engaged before, during, and after the workshops that the province with Infoway's help are holding. So we would be happy to help facilitate that, or even run some of these workshops for other jurisdictions that have an interest in doing this as well.
So
and then obviously using the maturity model, applying it, and feeding back to us any thoughts you have about, bugs or features or revisions you would suggest.
Okay, cool. So another couple of questions. Are there any examples in Canada of a structure or organization that approximate this HIN model you've described?
Well, I'm sure there are many. I mean, I am not intimately involved with the operations in each province across the country. So yeah, I would say there are pockets of very, very good examples of this throughout the country, and we could certainly help folks understand where those are and leverage those as well in the context of these workshops.
And another question, how are you approaching information governance in the context of a HIN? Or is this part of the discovery framework, or is it assumed?
Yeah, that's a very good question. Certainly, obviously, it's more than just data. It's information, and governance of that information takes on many, many forms. You know, relates back to the access to the data and these data sharing agreements. It's got to respect privacy and confidentiality and consent. Another aspect of information governance is around the quality of the data and consistency of the data among systems. I mean, we know personally here in Canada, and I know from other countries, you know, trying to harmonize, if you will, laboratory data and being able to view that in a consistent way is very, very challenging. So that kind of governance of the data for consistent use clinically, not only by humans, but making it computational is a big challenge. And so, yeah, that's a great question, and kind of information governance has many, many facets to it that require various kinds of subject matter experts to deal with it.
Good. Yeah. So another statement and question here is someone based out of the U.S. where they make the observation that interoperability has largely been a study in futility. How are you able to ensure interoperability in terms of the operation of a HIN?
Well, that's a great question too. It's, you know, there's a number of approaches. One is certainly certification. Probably even more important is conformance testing. So, you know, that has to be a part of it. I applaud what Ontario's done. I was just recently down at Mohawk College for the Apps for Health event, and on that day they announced the standing up of a sandbox that mimics their, what I'll call their health information network environment here in Ontario. So it gives folks a place to go to actually do that kind of pre-deployment conformance testing. And so I would assert that would be a best practice for every jurisdiction, whether it's a region or a province or territorial-wide jurisdiction, to have that kind of place and the right support services, like they're doing with the college, to make that available so vendors, especially those that are small and trying to enter the marketplace, have a place to go to test their products and services in a somewhat real-world context, obviously with fictitious data, but mimicking the real-world production environment in the province.
Very good. Another question. So the dial tone approach to services implementation in a HIN is intriguing. Did the research associated with this project identify any jurisdictions that have implemented such a model? Or is there anything we can look at even internationally?
Yeah, I don't know the answer to that offhand. As I mentioned earlier, each of the leading practices does in the full paper reference the actual HIN that demonstrated that leading practices, or HINs. There might be multiple HINs that demonstrated it. And they're all listed in the appendix, all of the organizations that were spoken to. So I would encourage you just to take a look at that paper and take a look at the references within each of the practices.
Okay, very good. Now, what is something that may not be clear out of the presentation is what is the motivation for HINs in terms of why have one, and how do they complement or supplement the EHR repositories that have been implemented across the country?
Well, if you think about what we've done in Canada with the EHR repositories, what I referred to earlier as the HIL, to provide access to those, to authorize point-of-service systems and users, that is a HIN. It's a HIN largely around data exchange and data sharing, and then, so we are there. You could make an argument we've got 13 or 14 of those across the country provincially, and some of the larger provinces have some that are regional as well. So what we were trying to do is how could we encourage these and enable these to be broader in capability and accelerate their success through this particular engagement, and ease that challenging path of interoperating within these health information network environments, because it is a lot of work now. It's part of the challenge is it's different in every province, and we've got to make that easier for the vendors, especially those that are small and want to enter the Canadian marketplace with some very innovative and compelling solutions, where they're just challenged by figuring out how to navigate our marketplace.
And then I think the last question we have is around the U.S. They've established a national framework for information sharing agreements, which is called DIRSA. Is there an appetite in Canada to develop something similar?
Yeah, we're actually doing that. Our privacy group is looking at data sharing agreements and how we could harmonize that and share best practices around those throughout Canada. So that's actually a project that was spawned out of the Interoperability Strategy work, and so we haven't completed that particular stream of work yet, but it is clearly underway.
Excellent. Well, terrific questions. Thank you, everyone, for your contributions. Certainly, you can approach us through email. There's lots of methods of connecting with Infoway if you have further questions. You'll receive an online evaluation form in a few days associated with this session, and it would be really appreciated if you would fill that out. This really helps us in terms of the effectiveness of this. And then after you complete and submit that form, then you'll be given a direction to the web page where you can download a PDF of this presentation and also view the recording of the webinar. Here's ways to connect with our presenter, Dennis, the website, as well as our blogs and other feeds that you can access from an Infoway perspective. Well, thanks, everyone. Great presentation. Really interesting stuff, Dennis. I'm fascinated by this whole topic. I think there's a lot of potential for it going forward. Thank you for joining us. We're going to call it a wrap then today, and we look forward to seeing you on the next webinar provided by Canada Health Infoway. Thanks very much.
Thank you again for joining us today. This concludes today's web conference, and you may now disconnect.